and welcome to this week's Care Vision Healthy Aging Conversation. This is the weekly opportunity at 4 o'clock on a Tuesday afternoon where we come together and talk about how to live healthily and how Care Vision's Healthy Aging can support you to enable you to live well and for longer in good health. And this week, my guest will be James Vickers, Professor James Vickers from the University of Tasmania. But as usual, let me first just bring you up to date with a couple of the new things that's happening at Care Visions. Last week, I told you about our Swinging 60s film, which enables you to join with the Beatles to the Rolling Stones and relive those days in the 1960s that many of us remember so well. That's proving enormously popular with thousands of people going and viewing that video. So if you haven't done so already, please do go to the Care Vision site and look at the Swinging 60s video. But this time, I also want to talk about your chance to participate as well. It's not just about watching videos, reminiscence videos, music videos, history and art videos that are all available on the Care Vision site. It's also about joining in. We started 2 weeks ago a physical activity class, and that's proving to be really popular. And you too can join in. It's on Friday mornings at 10 o'clock. And from the Care Vision site, you can register to join. Very simple registration process. 10 o'clock on a Friday morning for an hour. It's not designed for the super fit. It's designed for anybody who wants to participate and take a little bit of activity. And of course, physical exercise is not just good for your physical health, but also for your mental health and social engagement as well. It's a great way of reducing your risk of falls and feeling more healthy. So on a Friday morning, 10 o'clock, a physical exercise class. And then starting on Monday next week, so on Monday, the first Monday of October at 3:30 p.m. next Monday, we've got a massage class. Now, massage, you wouldn't have thought you can, but you can actually do it yourself with a self-delivered self-massage relaxation class, and looks at breathing and gentle motion that will help you engage and stay on top, from the top of your head down through your neck to your muscles of your chest. So if you want to unwind and have some healthy engagement, join our massage class next Monday at 3:30. And again, you can register for that on the Care Vision's Healthy Aging site. So for now, I'd like to introduce Professor James Vickers from the University of Tasmania. Now, as he's in Tasmania, I recorded this earlier because he couldn't be live with us this afternoon at 4 o'clock. So this will be recorded, so there won't be any chance to put your questions to Professor James Vickers today. But don't worry, because we're lining you up for a great opportunity with the Preventing Dementia course, which is run by the University of Tasmania. Again, anyone can join this entirely free of charge. The class starts next week on the 6th of October, and you can register. It's a 4-week course. You can register on the Care Vision site right now. And Professor Vickers will now tell us a bit more in my conversation with him about how you prevent dementia and live as well as possible. So enjoy the talk from Professor James Vickers, and we'll meet again next week for the next live conversation. So good afternoon, everybody. Welcome to this week's Healthy Aging Conversation. I'm delighted to have with me today Professor James Vickers, who's been held the chair of pathology at the University of Tasmania since 2003, and is one of the leading researchers around the world into Alzheimer's disease and other neurodegenerative conditions. It's also very important for Care Visions that he's here today because we've just started promoting in the UK the Preventing Dementia course, which is run by Professor Vickers from his institute in Tasmania, and we'll hear more about that. But anyone who's interested in signing up for that course can do so now on the Care Vision's Facebook site, and the course begins at the beginning of October, entirely free of charge, a 4-week course. But I'll ask Professor Vickers a little bit more about that as we go through our conversation. So James, great to have you with us. Everyone's feeling a bit depressed sometimes about coronavirus at the moment. So it'd be lovely, as I do most weeks, to start with you saying something about a happy moment that's occurred in your life in the last week or so. Do share a happy moment with us.
Thank you, Jeremy. Yes, so because of coronavirus, we're all a bit restricted these days. And so I've been trying to invent an interest in the garden through my wife, Charlotte. And we did plant some trees over our winter, which is coming into spring, which I had to prune back kind of savagely. So I did have a happy moment on the weekend, and we saw actually the trees are still alive, and they've got some nice green buds. So very happy about that.
Yeah, it's always a bit nerve-wracking. We planted some trees locally in the village I live, and they all died within the first year. So it was a bit disappointing. So you're doing well.
that's my usual outcome. So I was happily surprised that they're still alive.
Great. Now, dementia has become increasingly high profile really over the decade in the time that you've been at Tasmania. Can you just tell me a little bit about what got you into this line of research in the first place?
Yeah, so my main background is in neuroscience research. So that's studying human brains and some experimental animal models and nerve cells that you grow in culture. But I guess over time, even though that was I was hoping would be useful work and interesting research, I really was kind of led into trying to think about doing some things that were a bit more useful for human beings. And the Wicking Centre is a great place to do that kind of work because there's people with all sorts of different academic and clinical backgrounds. And so the idea of doing some more things in education and now in this area around managing dementia risk was a very appealing opportunity that we were only really able to do because I had great colleagues to help me do that.
And how big is the institute itself? How many people are involved at Wicking?
Yeah, there's about 40 or 50 staff, and then there's a small fleet of research students that we have, PhD students. But we also we've got research and education in our title, and both of those things are really quite important to us. So we've been doing the free online courses or MOOCs for some time, but we also have formal courses, an undergraduate degree and diploma, and more recently a postgraduate degree. And it's really great. We're getting quite a lot of people coming in to do those courses. And so it's really terrific to be able to interact with those as well.
It's really inspiring to see and probably quite unique in the world. And we'll come back to the courses a little bit later on. But tell me a little bit about the context of research into Alzheimer's and other neurodegenerative conditions, because the focus historically has been very much about drug development and pharmacological development. Is that going to be the answer, or is that still a very long pipeline to get anything coming through?
Well, I still think that is a long pipeline. I mean, there are a lot of really terrific research groups and researchers involved in that area, and there's certainly a lot of research money going into that as well, which has been great. But I think if we take pretty much any of the major conditions that cause dementia, like Alzheimer's disease, we're probably not quite yet understanding all of the fundamental cellular changes that lead to disease and pathology inside the brain. And I think once we understand that as well as we should, then we could probably come up with some much better drugs and therapeutic interventions to try and prevent those disease changes. But I always do say that, I think one of the good news story about conditions such as Alzheimer's disease is that they are disease processes. So again, if we understood those really, really well, we would know where to interfere in that disease process and stop dementia from happening in the first place, hopefully.
So whilst the pharmacological intervention program, as you say, is a long haul and there's a gradual increasing of learning, what seems to have accelerated a lot in the past 10 years or so is an understanding of how you go about preventing or managing the risks associated with dementia. I think about 10 years ago or a bit less, the National Institute of Health in the United States didn't really accept that there was any modifiable risks that could be associated with dementia. Tell me, what part have you played in changing that perception and that understanding of the risk factors, and where are we now?
Well, that research field, as you've noted, really has matured dramatically, really, in just the last few years. And this is research, I think, that's been going on for some time in the US and also in Europe and the UK in particular. And there's these long-term population studies that are really firmed up that there's a suite of risk factors that if we could potentially do something about those, then we would reduce the risk of dementia. But I guess it's important to note that most of our risk of dementia really lies around aging. The older you are, the higher risk you have of developing dementia. Genetics also probably plays a role there. But it is actually, again, kind of good news that there are at least this set of risk factors that seem to play a part as well. So again, the consensus is that if we could deal with all of those risk factors, which would be a very tricky thing to do, but if we could deal with all of them, then around about we would have to see a 40% reduction in the numbers of people developing dementia, which if you say compare that to any kind of drug intervention, that would be a very good result.
That would be an amazing result. And is that mainly in particular types of dementia? I mean, some people have said that vascular dementia is one that probably is more modifiable than Alzheimer's and other forms, or is it across the board?
Yes, we probably know more about Alzheimer's disease and vascular dementia, but then less so about the risk factors, the modifiable risk factors for some other causes, like frontotemporal dementia or Lewy body disease. But many of those epidemiological studies or population studies looked at dementia overall. So it is likely that many of those risk factors that are important for vascular dementia or Alzheimer's disease may well turn out to be important for other major diseases and causes of dementia.
And a lot has changed, as we said, in the last decade or last 5-6 years. What about the research that you're doing in Tasmania to take this forward, the epidemiological studies that you're leading? Where are they got to at the moment?
Well, we've got two major studies in this area. The one we've had, published on historically, has looked at the role of education. So again, lots of other people's work has shown that the more education that you have earlier in life, the less chance you have of developing dementia later in your life. And this is an idea that, but through education, you might build up reserve or a capacity to have higher amounts of resilience to pathology as it builds up inside your brain. It may not stop you from getting the pathology, but your ability to resist it might be higher. Where we got involved is to look at whether education later in life might have a potential beneficial effect. And we're based on an island of about 500,000 people. People don't tend to move very much out or into the island, so it's a very stable and aging population. So we convinced just over 500 Tasmanians to become involved in a project about 10 years ago, where about 400 or so got involved in doing more education. And rather ingeniously, we worked at a university, so we got them involved in university level education. Some did a little, some did quite a lot, and then we've been following them over time. And all the signals at the moment, we're about 10 years in, but it's really a 15-year project overall. But about 10 years in, we've basically shown that education might build your cognitive abilities in particular areas that are linked to resilience, and in particular verbal memory and language processing seem to be areas that will improve if you're an older adult who comes back into education. So we're hoping that building those capacities again might be sort of a bulwark against future risk of dementia. But we'll know about that in about 5 years' time.
That's a fascinating study. And how have you found out how intense that education process needs to be? Is it a heavy university course, or is it more accessible to a large number of people to participate in?
Yeah, that's what we're interested in sort of dissecting out now. Again, we know that some people did very little education, only a couple of university units, and some have done whole degrees and PhDs and things. There does seem to be a bit of a link to how much that you do, but it just seems to be the engagement in that university education is more important than the amount at the moment. But again, we'll see that over, we'll see how that pans out over time.
So the Lancet have published 2 commission reports over the last few years, the latest one just this year, talking about risk factors for dementia. Early education is certainly one in there. What are the others that stand out for you as the most important ones that people should be aware of?
Yes, so there are now, I think, 12 risk factors that the Lancet commissions have sort of landed on as being important. And some of these might be more important at particular stages of life. And there are some new factors in there, I guess ones that we've always suspected, but I guess the balance of the weight of evidence has indicated that they're going to be important. So some of these are largely vascular factors, and vascular factors are probably important for vascular dementia as well as for Alzheimer's disease, potentially for other major causes as well. So these are things like low physical activity, hypertension, obesity seem to be important. In later lives, social isolation seems to be important, but Diabetes as well seems to increase your risk. Smoking, depression in later life as well seems to be a risk factor. But then there were some interesting new ones like air pollution. Again, that's this balance of epidemiological studies across the world seems to show that greater exposure to air pollution seems to increase risk as well. So there's a number of these areas, but what we should emphasize, a lot of these are based on retrospective studies. So people looking back at various exposures and then trying to work out how much risk that might add to an individual or a population in terms of dementia. What we don't really know that if we, for example, people gave up smoking, whether that would lead to a dramatic decrease in the numbers of people who develop dementia. We've got some glimmers of evidence for that around in the area of hypertension, because now there's been lots of studies with large populations on now antihypertensive drugs, and that does seem to have a positive effect. For many of those other factors, we don't really necessarily know that if somebody changed their behaviour that related to that factor, whether that would then lead to decreased risk of dementia.
And of course, the Lancet report is really a collation of all the evidence from recent studies put together by a panel who consider that evidence. You seem to be in the forefront of increasing the level of evidence that there is. And the Island programme that you're now starting does seem to be one of the biggest studies and the most comprehensive studies that's ever been undertaken, precisely to find out a little bit more about the way in which people live and can modify their risk of dementia. Can you tell me a little bit about the Island programme that you're now developing in Tasmania?
Yes, so this is a relatively new program of research for us. But one of the things that's come out of all of these new epidemiological studies is the idea that maybe you could have a public health approach to reducing risk of dementia. So if part of the problem here is that people may not even know what many of these risk factors are. So can we get that out into a population, get them thinking about their individual risk, and then trying to encourage and support them to change the behaviours that relate to that risk. So we're looking to try and sign up about 10% of the Tasmanian population over the age of 50 for this Island study linking ageing and neurodegenerative disease, Island. Really is a bit of a pilot, because if we can make this work in Tasmania, maybe this is something that we can then extend out nationally and internationally. So we're looking for 20,000 or so Tasmanians to be involved in this project. We're around about 13,000 people. Tasmanians tend to be quite good volunteers for health and medical research, which is an advantage from working from this island. And what we're doing is we're providing them with a number of tools, like a dementia risk profile tool, which allows them to go through a survey, and that then highlights areas of risk and gives them feedback on what they might do to reduce that risk, or understand and then reduce that risk. We're also providing a number of, I guess, other sort of community-based opportunities, I suppose, to get involved in programs to reduce risk. We're utilising our free online course, the MOOC that we have around dementia prevention. That's also a tool that people can engage with, so they can understand their risk a little bit better. And I guess once you know about some of these risk factors, you can't unknow them. And maybe over time that helps to encourage them to change their behaviour. But basically, it's sort of a behaviour change and feedback program to see if people can actually tackle some of those risk factors in their own life.
And it does seem to tie in very closely to the work that CareVision's Healthy Aging have been doing both in China and the UK, looking at how do you engage people in a frequent, regular programme of healthy living activity that changes their behaviour and modifies their risk of a number of diseases, not just dementia, but ageing diseases in general. It sounds that's a very parallel piece of work.
Yes, that's right. So many of these risk factors are important risk factors for cardiovascular disease and many cancers as well too. So that if you can get some of those under control or reduce them individually and reduce their impact, you may well be doing yourself a favour, not just for dementia, but for a whole range of other things that might pop up as your years advance.
And how long will that study go on for, the Island programme?
You'll get it designed to run for 10 years, and our main outcome over the first few years is to see whether anybody changes their behaviour. Because if we don't get the behavioural change that is linked to those risk factors, then again, as a public health intervention, it's probably not going to play out so well over time. And then over time, we'll be comparing the relative risk of this group of people in our island program with the risk of dementia in the wider Tasmanian population.
The other study that I've come across that sounds similar in some respects is the finger study run out of Finland. Can you say a little bit about that and how that compares to the work you're doing?
Yeah, so this is a good program that's become quite popular around the world. There's now a worldwide fingers program where the study that arose initially with Finnish population, which was looking at what they call a multi-domain intervention. So this is where the participants are encouraged to engage in a number of programs that again targeted at these risk factors, and they certainly found benefits over 2 years in particular cognitive domains. But I suppose the question still remains that if you get that cognitive benefit, does that then play out in terms of risk of dementia over the longer term? And that's something I think we're all waiting to see might occur. Their approach also is a little bit different to ours. The multi-domain interventions tend to be very well structured, and the participant is, essentially guided in what they do. Whereas with Ireland, what we're trying to do is encourage what we call kind of self-efficacy in managing their dementia risk. So a lot of that is really about that individual understanding their own risk and then providing them with the tools and the knowledge to do something about that risk. And then it's kind of up to them as to whether they do anything about it. But that's more of a sort of a public health approach, yes, health promotion kind of approach than here's a structured program. And if you do this, that, and the other thing, then that may well reduce your risk.
And in the island study that you're developing in Tasmania, will you be guiding people in the frequency which they should take actions, or is it going to be up to them and you're going to monitor depending on what they choose to do?
That's right, yeah. So we'll be monitoring them on a yearly basis, where they'll undertake surveys and online cognitive tests. We're also interested in looking at biomarkers of neurodegeneration. So we'll be taking blood samples and looking genetics and all of that as well. But it's essentially it's educating people to consider their risk. And again, we would hope that then is sort of ends up with a virtuous cycle where they understand and think about their risk, and then over time they're actually doing things to reduce that risk.
So that's an academic study that's going to run for the next 10 years in Tasmania. But the other aspect I want to come on to is the courses that you've been running, because they seem truly inspirational, because they're saying that to anyone, it's not only looking over and seeing the research that you're doing at the university, but there's actually things that they can do themselves. And as you said, the title, the massive open online course, the MOOC, massive being a very operative word, because you've had a load of people involved in these courses. And as I said at the beginning, Care Visions is now partnering in the UK with you to promote enrolment for the next Preventing Dementia course, which begins on the 6th of October. But can you just tell me a little bit? I think firstly, there's an Understanding Dementia course, isn't there? And then a Preventing Dementia course. Can you explain what's the content in outline of those courses? What do people sign up to?
Yeah, sure. So the Understanding Dementia MOOC has been around for quite a lot longer than the Preventing Dementia MOOC. We started that one in 2013. And that was on the back of, again, evidence that came not from the Wicking Centre, but also from other sites, that there were knowledge deficits about dementia. And it didn't really matter if you were a family carer or an aged care worker or a nurse or a doctor, someone who works in allied health. There was a good chance that if you're then interacting with somebody with dementia, then not knowing enough about dementia could be a bit of a problem. So really Understanding Dementia was trying to be a bit remedial in that area. That's got 3 major modules. It starts off with the brain, so a bit of neuroscience to begin with. And then we go on to the diseases. And so people understand how those various diseases affect the brain over time, and that most forms of dementia are progressive and degenerative conditions. And then once you understand all of that, then that that will change how you think about care and providing support for that person with dementia. So it was really trying to, I guess, help a variety of different groups of people with their understanding of dementia. And part of that was to try and reduce the stigma of dementia, because once you understand the condition a little bit better, hopefully you'll be less frightened about that. So that it's done reasonably well. And then in 2016...
And how many, and the participants in that are mainly medical professionals or the wider public in the Understanding Dementia courses?
It's interesting demographics. It's mostly women in a caring role. So they're either family carers or they're working in the aged care sector as nurses or support workers of some kind. We don't get as many doctors as we would like to get involved in that course. And so it's doctors and men we have difficulty in reaching. So two groups that probably need to know more about dementia broadly. But yes, when we run these courses, especially in these COVID times, I think people have got a bit more time to spend around learning and doing that online. So when Understanding Dementia Week runs, we get about 27,000 people in each individual course. About 2/3 of those are from Australia and about 1/3 from just about every other country in the world.
Right. And so that's the Preventing Dementia course, which is the one that's being promoted at the moment in the UK with Care Visions. What's the difference between that and the Understanding Dementia?
So again, one of these things that we wanted to address is that people broadly didn't have a very good understanding around risk and modifiable risk related to dementia. So if we can get more people knowing about that and thinking about that, then there's a chance that we might, on a population level, get a lower incidence of the conditions that cause dementia. So this one is organised into 4 modules. Really, the first module tackles the evidence around dementia prevention and dementia risk, like how much of it really is related to things that you can possibly do through your own life and in your lifestyle. Module 2 focuses on the key vascular factors, really. So it's dementia risk. It's not all in your head. So it's all about the things that you can be doing for your good vascular health, good physical activity, looking at the impact of smoking, alcohol, and other things on dementia risk. The third module is really about, I guess, using your brain to help protect your brain. So this is looking at areas such as depression and education and concepts such as cognitive reserve. So again, that ability to resist the pathology of the disease. And then the fourth module is really around intervention. So that looks at a whole variety of research around the world, including the finger study and related studies, and then those key strategies that people might want to look at to look at reducing those risk factors in their own life.
And how big a commitment is it? If somebody watching this is interested in signing up to the course, is it how many hours are they signing up to over how many weeks? And is it accessible to everybody? It sounds quite a detailed course.
Yeah, so it's a 4-week course, and we estimate it's around about 8 to 10 hours if you do everything. Some people come on and actually just do the videos, but there's infographics and discussion fora as well too. So it really depends on how much you want to do, but it's something you can do on your phone or computer or your iPad or equivalent. So it's quite accessible. And one of the interesting things about it is that you are doing the course with people from all around the world. So it's one of the things we didn't really anticipate when we started these courses is the value of hearing about everybody's experience in these areas from across the world, many different countries and nations.
So you do have contact with the other course participants. You're not entirely on your own when you're undertaking the course.
That's right, but it's sort of up to the individual how much they engage in that area. Some people spend a lot of time there reading things that lie under the various discussion topics. Some people skip over and just watch the videos, read the transcripts.
And you've now had how many people participating in these courses over the years?
It's just over 400,000 now.
Fantastic.
And yeah, which is quite a big number. But when you think about it, that is a big number, but it's still it's just a shadow on what we really need to do and people we need to reach. Because if we think about, again, understanding dementia, all the stigma that's associated with around dementia and the poor understanding, that's really something that, you know, the wider community needs to know about. Dementia risk, well, we're not really going to shift incidence unless we get a wide public understanding of what that risk is. And then we can do as individuals or societies to reduce that risk.
And going back to what you were saying earlier in our conversation about the nature of the research and the understanding we have, some people have been critical about the fact that the course is called Preventing Dementia, where in reality you can't totally prevent dementia. Well, how do you deal with that challenge, that maybe it's a bit misleading when people think it's preventing?
That's right. It's really about modifying your risk. So some people who might be low in all of those risk factors can still develop dementia, because overwhelmingly the biggest risk factor is aging. So when you get into your 80s and 90s, then your risk of dementia is going to be quite high. So it's really about modifying that risk or building resilience to that pathology as it builds up inside your brain. So yes, by doing the course and following the guidelines, it doesn't necessarily mean that you will not develop dementia in your lifetime. But what hopefully it'll achieve is reduce your risk, or maybe at best it'll put off the onset of dementia to much later in your life.
And it's one thing, of course, to have a general course that tells you the risks for a population and for a wide range of people. Is there anything that you can do in the course or at the end of the course that brings it back to the individual and to your own personal risk? Is there something people can do to assess their own risk and what action they should be taking?
We're hoping to build that into future iterations of the course. Again, we've developed a dementia risk profile tool, which we're trialling in the island study in Tasmania. Now that in itself is a bit of an intervention as well too, because again, once you get this sort of report, if you like, which is by way of a traffic light kind of system, so either you're at high risk, moderate risk or low risk, that provides actually good feedback for people to think about and consider, and may well impact on their behaviour then related to that risk. So we're developing that up in a format that, again, people can use on their phones or computers or wherever they may be. And we're hoping in the future to make that available to people who go through the MOOC.
That's fantastic. And has there, for people who've already participated in the courses, has there been any follow-up or feedback you've had from the participants about the change that's happened in their lives as a result of being a participant in one of your courses?
Yes, sure. So we get lots of sort of anecdotal reports, but we have run now a couple of research studies where we do follow-ups on people. We get them to tell us about their risk through surveys that we run through the MOOC, and then we come and follow up with them 6 months later. And we do see shifts in many of those areas that we've described that are related to risks. But at the moment, that's just shifts in behaviour. We still don't know whether that really means anybody is at actual lower risk of developing dementia later in their life. Those are very long-term studies that we hope to be able to do. But our ambition is that you know, with what we're learning from Ireland is something that we can then extend more globally in time, and then to be able to reach as many people as possible, it has to be largely web-based. So it'll be an internet-based program, if you like, largely. So again, we're testing out how that works in a Tasmanian context, and hopefully in a year or two we'll be ready to roll that out more widely.
Well, James, that's brilliant, and thank you so much for spending time with us today. We're right out of time. It's been a fascinating insight both into the combination of the research you're doing, but also bringing that research knowledge to people so they help them manage dementia in their everyday lives. And I hope thousands of people will sign up to the Preventing Dementia course that's currently being promoted by Care Visions. So James Vickers, thank you for being my guest this week. And just to let everyone know that my guest next week will be Martin Green, the Chief Executive of Care England, the organisation that represents all the care home providers. And we'll have a fascinating conversation with him about dealing in care homes with coronavirus, and how do you support people to live well and engage well despite the restrictions that we're currently under. So James, thank you very much for being with us today.
Thank you, Jeremy.